one person who is going to be there here from Virginia is Congressman Bobby Scott. Bobby Scott, as I told you, he will have a guest with him, a home care worker. Her name is Renee Bumbry Graves, who says that she lost her health insurance due to the Affordable Care Act premium tax credits not being extended. Remember, that was the focal point of that first and now historic government shutdown. So our own Jeremiah Beatty interviewed Scott just about an hour and a half ago, and he spoke to her about what he hopes to hear tonight, but really probably about his thoughts on the state of our union.
Why was it important for you to bring Rena Bumbray Graves with you to the State of the Union address tonight?
Well, Rena represents an example of the damage done by the healthcare premiums not being continued. We had a major tax bill. We could have easily inserted that to continue them, but the Republicans decided to end the enhanced premiums. And as a result, her premiums went from $544 to $1,300, which she could not afford, and now she's uninsured. And this is the story of millions of people across the country.
Yeah. And I know it represents so many, but when you thinking about her story, what touches you the most?
Well, what touches me the most is we could certainly afford it. We had a bill that put us over $4 trillion more in debt. This extending the premiums for 10 years would have only cost $300 billion, about 10% of the additional debt that the big ugly bill put us into. So it was easily affordable. We could have done it, and yet this kind of pain is being inflicted not only on the people that lose their insurance, but because we have millions more uninsured, that'll affect everybody's insurance because they will get sick, go to the hospital, and not pay. Who pays? The next person that goes will be charged a little extra to compensate for that, for the fact that someone was uninsured. So everyone will be adversely affected by this, but certainly most directly those that can't afford the new premiums.
And you could go to this address tonight by yourself. What goal does having her in the room accomplish?
Well, it focuses attention on the actions of this administration since he's been in office. Millions of people will be losing their insurance as a direct result of actions of this administration. The big ugly bill takes health care away from millions of people on Medicaid. The failure to include the enhanced tax credits for those on the Affordable Care Act will cost millions more of their insurance. And because of those millions of additional people uninsured in the healthcare system, everybody else's premiums will go up because people not paying shifts the cost to those that are paying. So everyone will be disadvantaged because of the actions of this administration. And just as an example, Rena's experience where her premium will go up, would have gone up from $544 to $1,300, which she could not afford, and she is now uninsured.
Hearing her story, just she's having to make a lot of tough choices because of that and live in fear if something bad happens. My next question is, if the president talks about the economy or healthcare, what will you be listening for?
I'll be listening to how he explains the number of jobs created in his first 12 months in office. He created fewer jobs in a whole year than Joe Biden created in an average month during his 4 years of a presidency. I'll be looking to see how he explains that, how he explains the cost of living going up as a direct result of his tariffs, on and off, but certainly upward pressure on prices. So affordability is a major effort. I'm sure Governor Spanberger will be talking about that in her response, how she is working to reduce the cost of living, whereas President Trump is, as a direct result of his actions, increasing the cost of living.
Do you think there's a chance the president could possibly win the hearts or change some hearts tonight? And if he is able to do that, what do you think people need to hear?
Well, first of all, I think he probably will win some hearts because of what he says, but when they fact check what he says, they'll find out that he didn't tell the truth. He is notorious for not telling the truth. And in one debate with, we calculated 30 questions, they calculated that he told 30 lies. He is not, the number of false statements he's made, for those keeping track, is in the tens of thousands over the course of his first and second presidency. So I expect him to do well until he's fact checked.
Then, just to kind of tie it back to the local impact, for people in your district who could be facing, higher premium costs, how many people in your district could be facing increases like Rena's?
Tens of thousands of people will be losing their insurance as a direct result of the actions of this administration. Costs are going up because of the tariffs. Jobs are being lost because of the economic policies of this administration. The worst job performance of any president in modern history. We'll be looking forward to see how he explains all that.
You kind of already touched on that question. Do you think the president will be open to hearing from people like Rena? I know you're not him, but
The president has shown no interest in healthcare. In fact, the Republicans have shown no interest in providing healthcare. They have spent the entire year taking insurance away. Millions, tens of millions of people, over 10 million people in Medicaid, 5 million people in the Affordable Care Act, losing their insurance after years of hard work to try to get people insured. This is the legacy of the Republican Party and this president. And so for those who like insurance, they can't like what they've done and would be interested in what he's going to say about it in his State of the Union address.
In the end, when on my report today, talking about, Rena joining you at this address, what do you want people to know? What's the most important thing you want to highlight here?
Well, what we want highlighted is this: that she represents a live example of the results of the policy of this administration. Live people will lose their insurance and become uninsured as a direct result of premiums going up from $544 to $1,300. If you had a reasonably tight budget, but were making it, that additional expense was just unaffordable. And so she is now uninsured, and if she gets sick or something and has to go to the hospital, that'll be out of her pocket. That's what happens when you implement the kind of policies that the Republicans in this administration are doing.
So that was Congressman Bobby Scott ahead of tonight. And again, he's going to have a guest. Her name is Renee. She's going to be with them during that State of the Union tonight.